Well, a warm welcome to today's talk, Thursday the 19th of January, and we're reporting today from a cold north of England. I had hoped to be in Davos for the World Economic Forum, but unfortunately I wasn't invited, as I suspect you weren't. Maybe more on that later. Now, let's start off with this paper here from the CDC that's created quite a lot of ambiguity and confusion. This is about the safety signal that's been picked up after the Pfizer vaccine as regards increased risk of stroke. So what is going on here? And as we'll see in a minute, the absolutely blatantly obvious has been missed by most commentators, or all commentators that I've seen on this. So let's look at the bit of the detail here. So CDC identified preliminary COVID-19 vaccine safety signal in older people aged over 65 in terms of stroke. And because of their commitment to transparency, that means you can see through it, they are sort of talking about this now, and they've published this publication here, and we'll be looking about what it says. Now, this relates to the Pfizer COVID-19 vaccine, particularly the bivalent, this new vaccine. Now, you will remember that this vaccine was not safety tested on humans. It was not subject to a human clinical trial of any form whatsoever. But at the time, we did note with a great deal of reassurance that it was tested in from memory. I think it was 10 mice who demonstrated that they produced antibodies to the vaccine. So whether this safety signal transpires to be true or not, the clinical trial is in essence being done now. We're seeing if it's safe to use in human populations because there was no pre-release trial. Anyway, CDC's vaccine safety Datalink met the statistical criteria to prompt additional investigations into whether there was a safety concern or not, looking at the older age groups. So, to be quite honest, so far so good. It's good to check these things. If there's a risk signal, then we should absolutely check it out. So far they're doing the right thing. More likely to have an ischemic stroke in the 21 days following vaccination compared to 22 to 24 days following the vaccination is what this statistic has demonstrated may be the case from this particular source as recorded in this paper. Now, it looks like, to me, this is very probably a statistical artifact, but that's not the point. That is not at all the point. Let's look at how they got this data. Now, I went through that quickly. So we see they've got two groups here. Group 1 were vaccinated on presumably day 1, and then they follow them up through to day 21. And they were more likely to have a stroke. So more likely to have an ischemic stroke in the 21 days following vaccination. Group 2, they follow them up from day 21 to day 42. They were less likely to have a stroke. Now, this is just really quite incredible. These are the two groups that the CDC is putting forward as a valid comparison. This really is quite an impressive thing that they've done here. So they're comparing that group with that group. Now, what mystically happens between day 21 and day 22 is a bit of a mystery to me. But they are actually comparing the 3 weeks after to the 21 to 21 day to 42 days after that, as if this is going to bring out some sort of interesting absolute truth. Why are they looking here? More on that in a minute. Just as we look through this paper, though, we do find out that no quantitative data is given. So what is the magnitude of this difference? We don't know. Be nice to be been told that in the paper. We're not told it. We're not given any quantitative information. They do give us lots of reasons this is not a valid safety signal. And actually, I tend to agree with them. I agree. It's unlikely to be a valid signal because it's comparing day 1 to day 21 and day 21 to day 42. What the heck are you going to get out of that comparison? They're looking in the wrong place as far as I can see. If I lose my keys in the front garden, there's no point searching the back garden for them because I'm not going to find them there. We need to have a realistic time frame to analyse this. Why aren't they doing this? It really is a bit strange that they're not doing this. Anyway, they go on to say, therefore, no change in vaccination practice is recommended. CDC continues to recommend that everyone, this is what they're recommending, age 6 months of age and older, stay up to date with COVID vaccines. Let me just clarify that. The CDC are advising COVID mRNA vaccines for 7-month-old, all 7-month-old children in the United States. That's what those guidelines say. You might think that's incredible that they're recommending that, but that's what they're recommending. Right, so that's what they recommend. This includes individuals who are currently eligible to receive a bivalent booster vaccine, which of course is what we're currently talking about. Then the site goes on to give lots of quantitative reasons to get boosted. So when they're talking about the safety signal, they don't tell you the magnitude of it. But then when they're talking about the reasons to get boosted, they give lots of data. Some people might say the data's out of date. And I think we're fairly safe in saying that, because by definition, the time it's published, it's out of date. But we cannot compare the current wave with the previous waves, with the Wuhan wave, the Alpha wave, the Delta wave. Now we're in times of Omicron with huge amounts of natural immunity. It is no comparison between those two timeframes. And yet, that appears to be what they are still doing. So that's another critique. Now, going on to this, what I consider these absurd comparison groups, the Group 1 and Group 2, with the completely, as far as I can see, arbitrary cut-off date of 21 days. Completely arbitrary as far as I can see. So we want to think now about the timing of adverse events. Now, this is from the group that dare not speak its name. You can click on the link if you want. And they suggest, and this is written by two very senior physicians. Again, we're not really free to talk about them, but two very senior, well-published, well-researched physicians, very senior physicians. They are thinking now that there's two peaks for complications. Now, they actually talk in this Substack about a particular complication. But I can't talk about that particular complication on this outlet, unfortunately. But it's a complication. I can't talk about the nature of the complication. They happened, this is the complication, either within a few days of vaccination, typically within the first week, which, as we know, we can talk about rare, I think rare is the term they use, heart inflammation causing myocarditis and then potentially arrhythmias. We know that's true. We have to say it's rare, but we know that's true. And then there are the complications that occur around 5. I'm not deliberately pausing here to raise suspense. I'm picking up another piece of paper. Months. And then there are those that complicate around 5 months later. And again, I put in the term complicate. That's not the term they used. I can't tell you what the complication is they are discussing. And then there are those that complicate around 5 months later, not 1 to 21 days. And this is related to fibrin clots. So the fibrin is the fibrin is actually the long. So what happens is you get a fibrinogen, which is the soluble protein in the blood like this. And when there's, well, you don't see it, it's just in solution. And then when it starts clotting, the fibrinogen precipitates out into these strands, long sticky strands like this. So these long sticky strands are the fibrin. And then what happens is the blood cells will stick to these fibrin strands like a net. And that's what causes the clot. It's the blood cells sticking to the fibrin strands. And of course, if that occurs in an artery supplying the brain, it will cut off the brain from a blood supply. I've been looking after people with stroke since I was 18. It's a horrible disease. If it's the left side of the brain that's affected, the right side of the body can be paralysed. If it's for the right side of the brain that's affected, the left side of the body can be paralysed. And as well, tragically, frustratingly, dehumanisingly really, people can sometimes lose the power of speech depending on the side of the brain that's affected as well. Horrible condition. We need to take it seriously. So that's what this group are talking about, this delayed effect. not within these arbitrary, very early time periods the CDC is considering. Now, stroke associated with COVID vaccines. This was from the Journal of Stroke and Cerebrovascular Disease back in March 2022, way back. Even before then, we knew there are increasing reports of various types of stroke. Ischemic stroke is where there's a blood clot stopping the blood getting to the brain. A hemorrhagic stroke is where there's a rupture in the blood vessel and bleeding into the brain. And these cerebral venous sinus thrombosis are in these large venous drainage vessels in the brain. After COVID vaccination, now these were the earlier vaccines. Most such patients are women under the age of 60 who have received the Oxford AstraZeneca vaccine. So as a result of this, and well before that, Denmark withdrew the AstraZeneca vaccine. They stopped the rollout in as early as April 2021. Denmark has been consistently fairly on the ball, actually, it has to be said. Not as on the ball as we would like, but fairly on the ball. US, South Africa, European Union all stopped the Johnson & Johnson. Of course, the Johnson & Johnson and the AstraZeneca are the two adenovirus vector vaccines, which were associated with a high rate of blood clot. Now, as far as I know, let me just show you what the British Heart Foundation says, first of all, before I make that point. British Heart Foundation, is the AstraZeneca vaccine still being used in the UK, is the question on their website. No, the UK government is not ordering for the supplies of the AstraZeneca COVID-19 vaccine. Phew. Thank goodness for that. Evidence shows that the mRNA vaccines, Pfizer, Moderna, are more effective at boosting protection from COVID-19. So the British Heart Foundation there appears to be saying that it's not that these vaccines are dangerous, the AstraZeneca is vaccine, it's just that these new ones, these mRNA vaccines, are better. Come on, British Heart Foundation, let's have some honesty and integrity here. Let's give the real reasons. If you think the reason is that they're more dangerous, just say so. If you don't think that's the real reason, of course, then carry on with this sort of form of wording you've got. Otherwise, change your form of wording. You know, I actually can't remember the British government formally withdrawing the Oxford AstraZeneca vaccine. They've just stopped giving it. They've kind of done it on the quiet, really. We would say on the QT. They've just sort of stopped it. At least Denmark, the United States, the European Union had the honesty to say, look, we're stopping doing this now. So one negative mark for the British government there, in my view. So these vaccines are being recommended for the autumn booster campaign. So really, I mean, it's just that these new ones are better. Was that why we've stopped giving the Oxford AstraZeneca? Oh dear. Now, as I did make a snide remark at the beginning, I haven't been invited to the World Economic Forum. I was looking forward. I was sort of sitting there drumming my fingers, waiting for an invitation. But I think you probably have to go by private jet. Maybe that's why I haven't been involved. But don't they realise I have a 500cc motorcycle in my garage? I'm not completely without transport. And you haven't been invited either. So we have our more intelligent, richer and betters deciding what's good for us in Davos at the moment. Secretary General's remarks to the World Economic Forum. We need cooperation, yet we face fragmentation. True. Not quite sure why. Is it anything to do with lack of transparency, I wonder? And the fact that we're not told very much at all and not treated with full transparency. But these are far from being the best of times, and the world is far from being united. Well, that's true. Instead, we face the gravest levels of geographical division, mistrust in generations, and it's undermining everything. So there we go. Mistrust. We have high levels of division and mistrust. And the way to overcome mistrust is to be completely honest and open with us, not to hide behind bureaucracies, not hide behind forms of words, not hide behind looking for the data in the wrong place, not hide behind looking for your keys in the front garden when you lost them in the back garden. Let's have open honesty. We're not as stupid as we look. Be open and honest with us in all of these things, and that would really help. Apologies if that was over political, but it just seemed to fit for some reason. So there we are. The current stroke guidelines there do seem to be a statistical artifact based on the completely, as I can see, absurd two-group comparison that they're using. One group, day 1 to day 21, group 2, 21 to 42. Pathetic comparison groups in my view, but there again, that's the CDC. If you live in the United States, you pay them a lot of money to generate this data. And for now, thank you for watching.